Hello my dear friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to discuss about the chapter number 13 where we'll be discussing about the blast, the injuries produced by blast and thermal injuries, plus one more topic we are going to study in this, that is cold injuries my dear friends. Now what will happen if I tell you the blast is happening, if this is a bomb, if this is bomb my dear friends. If this is a bomb, when there is a bomb blast, what will happen? There will be a fire first. First there will be fire like this. You will be seeing like this. Then sir, after fire, there will be the energy waves. Energy waves which will be going first, beyond everything. Now, this energy waves, what they can damage. They can damage everything which comes on their way. Plus, because of these waves, I can write here waves. Because of these waves, what will happen? There will be a damage to structure, like this is building and this is car. So what will happen if these waves will hit the building, the glass of the building will go further and hit the other people or other buildings. Plus this building can also collapse down. This building can also fall down, can collapse down. If I tell you about the car also same thing will happen. What same thing will happen? The glass of the car will hit, plus if there is any other thing will hit the people, plus there are the high chances that if person is walking on road, there are the high chances if a person is walking on road, that person will be thrown away, and if that person is thrown away, there will be the injuries, might be the head injuries. Most commonly we get head injuries. Person can have the fracture, contusion, laceration. Plus, what if the whole of the building will fall onto the man? If whole of the building will fall on the man, my dear friends, what will happen? There can be a traumatic asphyxia. There can be a traumatic asphyxia. So these are the ways by which the blast injury can damage the things, my dear friends. Again, if I want to summarize for all of you, this will make very much simple for all of you. If I say this is the bomb, now there is a fire. After fire, there are the waves. These waves are very dangerous, my dear friends. These waves are very dangerous. First, what they can do? They can damage the things, they can throw the things, damage, breaking down. They can break down the things, they can throw the things. Throw things, mechanical asphyxia. Mechanical asphyxia can happen if the objects are falling. There will be a contusion. There will be laceration. So all these things can happen in the blast injuries. Now, the blast injuries, there are the two important things which you need to take care of. One is where this is happening, under the water or above the water. So that is also the primary factor you need to take care of. So first, if I just talk here one by one about the blast wave first, as these black colors are the waves. Waves, my dear friends, pass through the body of the person. Waves will pass through the body of the person, can pass through the objects also. It will pass through the objects also, wall, etc. It will push. When the waves will pass from the body of the person, it will tear the structures. So we'll see which structure first is gone, then which last need to be gone. So all those things we need to study in the blast wave. The first product released after the bomb blast, after the fire, would be the blast wave, my dear friends. Now, first organ is ear. First organ is ear, and in ear, my dear friend, tympanic membrane rupture is most common. Tympanic membrane rupture is most common. So if there is a bomb blast, number one organ to be damaged would be your ear, my dear friends. Followed by lungs, followed by lung, followed by lung. Lung blast will be there. Then GIT, there will be colonic perforation. In GIT, what will happen? Colon will perforate. These injuries are called as primary blast injuries. So these you can see, they are the hollow structures. All the lung, ear, GIT, they are the hollow structures. They are the hollow structures. They are the hollow structures. They got damaged, and these damage are by the blast waves, my dear friends. These damage are by the blast waves. Now what will happen on the second go, my dear friends? In the second thing you will see, because of these waves, once it touches the body, they can damage everything. This is primary blast injury, but they can also get contacted to the objects. For example, glass. I have taken example of objects like glass, objects like any iron, nail, objects like any kind of bottle, etc. These objects can fly, these objects can hit us. When these objects will hit us, there will be contusion. There can be contusion. For example, contusion can happen with any kind of the stick, bottle, unbroken bottle, or any heavy object. Any heavy object, if they will hit the body, my dear friends, if they will hit the body, there will be contusion. What is contusion? Contusion means extravasation of the skin. The blood is collected just under the skin because of the vessels which are damaged. Vessels which are damaged, mostly the superficial veins which are getting damaged, because veins are present superficially and the arteries are present in the deeper course, my dear friends. Then because of these structures, there will be a abrasion, and that abrasion can be pattern abrasion also. Pattern most commonly, you will see pattern. For example, my watch is hitting after bomb blast, so there will be pattern of watch, my dear friends. If any other object is hitting my body, there will be abrasion, that is pattern abrasion. You will come to know about the type of object which hit the body, my dear friends. We can easily. Then third thing is laceration. Laceration can happen with any pointed edge object. Pointed end object. Laceration can happen with any pointed end object, my dear friends. These three together, if I just erase it and I can just rewrite it again, these three together is Marshall stride. Marshall stride. These three together are Marshall stride. So these are also called as secondary blast injury. So what is happening? First, the waves are coming, they are affecting the body, plus along with the waves, the objects are coming, and objects are also hitting the body. The objects are also hitting the body. Now, third thing is victim displacement. Now your body will be thrown away. Now these are the waves which will throw you away. These are the waves which will throw you away. and it can lead to skeletal fracture, my dear friends. The bone can be fractured, skeletal fracture will be there. Now these injuries are called as tertiary blast injuries. These injuries are called as what, sir? Tertiary blast injuries. So victim displacement, what will happen in the victim displacement? Now the waves are coming, waves are throwing someone down, and there will be a skeletal fracture. Also there can be a, plus there can be the laceration. Plus there can be grazed abrasion. Grazed abrasion can also happen, because when the person will just roll onto the road or any surface, there will be the friction, and because of friction there will be abrasion. There will be what, sir? Abrasion. There will be abrasion. Now fourth thing, what will happen? Miscellaneous. Miscellaneous injuries like heavy object on body can lead to asphyxia. For example, this was the building, and sir, this building collapsed and people were running under the building like this. Now this building fall onto them. Once the building fall onto them, they will lead to the asphyxia. This is called as traumatic asphyxia. Traumatic asphyxia. So these are the four things you need to remember on the primary go, sir. What we have learned here, sir. First is blast wave. First thing is what, sir? Blast wave. Blast wave can damage the hollow organs very commonly. First organ which is damaged would be your ear. In ear, what is getting damaged? Tympanic membrane rupture is the most common and the first one. Then lung will get blast. Then GIT, my dear friends, and these injuries are called as primary. GIT, there will be a colonic perforation. Other than that, there will be flying objects which are coming. Flying objects can be glass, can be any iron nail, can be any plastic object. They'll be hitting the body. Because of their hitting, there will be pattern contusion, pattern abrasion, pattern laceration. And these injuries are called as what, sir? Your secondary blast injuries. Then tertiary blast injury. Tertiary blast injury, what can happen, sir? Victim will be displaced. Moment the victim is falling somewhere, like here person was standing, like in South movie we have seen, bomb blast is there and victim is falling 10 km away. When he is falling away, there will be a fracture, there will be laceration, there will be contusion, my dear friends. Then coming to the miscellaneous part. Miscellaneous part, what can happen? Any object, for example building, for example car was the flying object and it fall onto the person, my dear friend. In all those scenarios, what can happen? Your mechanical fixation of the chest, mechanical or you can say traumatic asphyxia, which can lead to the death, my dear friend. Which can lead to, also it can lead to the crush injuries, and these injuries are called as quaternary blast injuries. So primary, secondary and quaternary blast injuries are clear to all of you, my dear friends. Now we are moving on to the next topic, that is underwater blast. Now underwater blast injury depend on the level of head. So level of head is very important. Where your level of head is. If your head is above the water, if your head is above the water, my dear friends, head above the water, then there will be which injury, sir? GIT injury. Then your intestine will be damaged first. Then if head is below the water, if head is below the water, then tympanic membrane rupture will be there first. Tympanic membrane rupture will be there. Head above water, head below water. The next topic what we are going to start is heat injuries, my dear friends. Heat injuries, we see the general one. Generally, we are having the heat cramps, heat exhaustion, heat stroke. So, three things we need to learn right here, sir. Heat cramps, heat exhaustion and heat stroke. And local injuries, we are having burns and scald. Burns and scald. Now, we talk about the heat cramps first. The number one topic what we are going to talk about is heat cramp. And the burns are happening because of the dry heat. Dry heat means fire. And if I talk about the scald, scald is moist heat, and moist heat example is steam. Steam is the moist heat, my dear friends. Now coming to the heat cramps. What is the mechanism of action of heat cramps? There will be increase in sweating. Moment there is increase in sweating, in sweat, what you will lose? You will lose the electrolytes. For example, sodium, potassium, you are going to lose the electrolytes. And moment there is a deficiency of electrolytes, what will happen? There will be the muscle cramps. So heat cramps are happening how? Primarily the sweating is happening. After sweating, what is happening? There is loss of electrolytes. And after electrolytes, there are the muscle cramps. Now, what are the sign and symptoms? What sign and symptom of the heat cramps, my dear friends? Sign and symptom include the sweaty skin, for sure. The sweaty skin will be there. That is the main culprit. Plus, core body temperature is normal. In the heat cramps, you will see the core body temperature. Where to measure the core body temperature? One place is esophagus. Another is rectum. So these are the two places which are the best places, and in esophagus also 24 centimeter deep. Here is 15 centimeter deep. Normal mental status. Body temperature is normal. Mentally the person is absolutely normal. Abdominal muscles are stiff. And the person is feeling the fatigue. The person will be very lethargic and very sleepy. Now, what are the sign and symptom? Sweaty skin, core body temperature is normal mental status, abdominal muscles are stiff, and they are fatigued. The person is fatigued, my dear friends. And two ideal sites where you get the best core body temperature. One is esophagus, another one would be your rectum. Now coming to the treatment, how you will treat such condition? Electrolyte replacement. And per oral, if you need to give the fluid, the best fluid is ORS. The best fluid is what, sir? ORS. What ORS is having? ORS is having sodium, glucose, potassium, citrate, and chloride. How much sodium we are having? 75 millimole. Glucose same 75. Potassium it is 20. Citrate it is 10. Chloride it is 65 by difference. So how the ORS, what WHO guideline is there to give the ORS? WHO guideline, my dear friend. WHO guidelines say, what they say? They say 1 pack mixed with, the correct word is mixed with, 1 pack mixed with 1 liter of water, normal water, 1 liter of normal water. This is how we do the electrolyte replacement. Also, if there is a severe losses, then we can go with the IV fluids too. IV fluids, my dear friends. Best we can go with the ringer lactate followed by the normal saline. So these are the ways by which we can give the treatment. Moment the electrolyte replacement is done, you will see the person will feel normal. Now coming to the next topic. The next topic is called as heat exhaustion. The next topic is what? Heat exhaustion. What is the mechanism of action of heat exhaustion, my dear friends? First we'll see there is a excessive sweating. Again leads to the dehydration. And moments there is a dehydration, what will happen? Because of dehydration, the venous return is decreasing right now, sir. Moment the venous return is decreasing, there will be a cerebral hypoperfusion. That means brain is not getting adequate blood. So excessive sweating leads to dehydration. After dehydration, venous return will decrease, my dear friends. Venous return is decreased, cerebral hypoperfusion will be there. What sign and symptoms you can have right now, sir? Sign and symptom, dizziness. Because cerebral hypoperfusion is there, so there will be the dizziness. Plus plus you will see the core body temperature is normal. Now only we have seen two things. Core body temperature, one is rectal, another is esophagus. Another is esophagus. And the pupils are dilated. Pupils are dilated. Pupils are dilated. Skin is moist and cold. The skin will be cold now. And there is a excessive sweating. Excessive sweating is happening. Skin is cold. The body is cold. Pupil dilated. Person is dizzy. And core body temperature is normal. So treatment. We'll do the leg elevation. What will happen when we'll do the leg elevation, sir? If I just show you right here. This leg is elevated. Moment the leg is elevated, what will happen? The venous return will increase. More the venous return will be, the brain, if there is a brain will also get more hyperperfusion, or you can say perfusion of brain will happen. Not hyper, perfusion of brain will happen, and all those symptoms like dizziness etc. will be treated. Fluid replacement again we'll give, sir. This also we will try to see what type of dehydration is there. If it is mild to moderate dehydration, then we give the ORS. If it is severe dehydration, then we give the IV fluids. And the fluid of choice is Ringer lactate. Fluid of choice would be what, sir? Your Ringer lactate. Now the third term what we have right here, sir. The third term what we have is heat stroke. Impaired heat regulation. What is happening right now, sir? Impaired heat is not regulated properly in the body. Now signs and symptoms like altered mental status. Plus core body temperature is high right now. And from where to measure the core body temperature? The two sides are there, rectum and esophagus. Pupil is constricted. If we compare this with the, you will see heat stroke with the heat exhaustion. In heat exhaustion the pupil was dilated, but in the heat stroke the pupil is constricted. Now skin is dry and hot. In heat exhaustion it was cold, my dear friends, but in the heat stroke it is dry and hot. Anhidrosis means absent sweating. The sweating is absent. Heat stroke, sweating is absent, my dear friends. This is the main feature right here. Heat stroke patient, sweating is absent. Sweating is absent. Now triad of heat stroke, if you have to see the triad of heat stroke, you will see rectal temperature more than 41. The core body temperature is high. You can see right here, sir. Plus CNS symptoms are there. Like altered sensorium is there. Plus dry skin is there and sweat is absent. Dry skin plus increase core body temperature. CBT is increase, or you can say high. Plus there will be a altered sensorium. This is a triad of heat stroke. Very important triad you need to remember for the exam. On autopsy, what you are going to see? Postmortem caloricity. What is postmortem caloricity, my dear friends? In the first, normally what will happen after 15 minutes, your body temperature will start falling down. But in some causes of death, like tetanus poisoning is there, like your heat stroke is there. In these all cases, cholera etc., you will see there will be a initial for first 2 hours. For first 2 hours, there will be increase in body temperature. Body temperature will increase for the first 2 hours. This is called as postmortem caloricity. Necrosis is seen in the Purkinje layer of the cerebellum. Bellum is responsible for, what is the function of cerebellum? Cerebellum will do what, sir? Or control, planning and programming. Also control. Main control is where? On the cerebellum, my dear friends. Cerebellum. And planning, programming also. Planning, programming. also there. How you will treat such patient of heat stroke? Ice packs, because core body temperature is high right now, plus IV and oral fluid. Again, oral fluid we can choose the ORS, and IV we can choose the Ringer lactate solution. So this is all for the heat wala thing. Now we are coming to the next thing is burn. The next topic what we are going to start would be what, sir? Your burns. It is due to dry heat. Burn is due to dry heat, and scalds are due to the moist heat, my dear friends. So let's first talk about the burn itself. Burn. The classification of burn was given by Wilson's. How it is classified? We can see the classification: burn by the tissue injury. So burn classification is divided like this: superficial partial thickness, deep partial thickness. So superficial, only epidermis is gone. This is called as primary burn, first degree burn you can say. And these two are called as second degree burn, and full thickness is called as third degree burn. Full thickness is called as what, sir? Third degree burn. Full thickness is third degree. What are the skins involved? You can see in the primary burn, or you can say superficial, only epidermis. Skin layers involved is only and only epidermis. The skin layer involved would be only and only epidermis, my dear friends. Clinical characteristics are dry, erythematous, blanches with the pressure and painful. There will be a dry skin like this. I'll show you very soon. Dry skin will be there, which is burned. Now if I talk about the second one, superficial or partial thickness, where epidermis and superficial dermis is there. Exudative, erythematous, blistering, blanching with the pressure and painful. Now blistering is the key word right here. When you are going to see the blisters, sir, in the first degree burn, blisters are absent. In the first degree burns, the blisters are absent, but in the second degree burn, blisters are present. Now deep partial thickness, where epidermis and deep dermis is there. Red, leathery, non-blanching, minimally painful. Now pain started decreasing. You will see first degree and superficial partial thickness 2A we can call it. In this, pain is highly painful. But your tertiary, which is full thickness, where epidermis, dermis, subcutaneous tissue, everything is involved, my dear friends. White to leathery to charred black, and this is non-painful. So which one are painful? If I ask you, painful, primary and secondary are painful. Which are painless? Your third degree burns are painless. Third degree burns are painless, my dear friends. If you see right here, sir, this is a normal healthy tissue. Very well, you can see right here. And first degree, you will see only the epidermis is affected. Only epidermis is affected, and this is painful. This is painful, my dear friends. Painful. Only epidermis affected, and this is painful. Then second degree, deeper injury is there, and it will lead to the blisters. Painful plus blister, pain plus blistering is there. Third degree, you will see burns involving all the layers of skin. Epidermis, dermis, hypodermis, even till the subcutaneous fat is involved right here, sir. Subcutaneous fat is involved, and these are the painless. These are the painless burns. Fourth degree, even muscle and bones are getting teared, my dear friend. Muscles and the bones are getting teared, my dear friends. So, how to give the fluids? If you have to give the fluids, the total body surface area calculation is very, very important. How to calculate the total body surface area right here, sir? We are having Wallace Rule of Nines for the adults. So, what it says, 11 surfaces are there which are 9%. One surface is there which is 1%, that is a penis. Now let's see with the help of diagram how we are dividing this, my dear friend. First I'll show you, then we'll write somewhere. Their head is 9%, my dear friends. Head is what, sir? 9% we can say. For face and head and neck, you will see 9% is there. Then for front of chest is 9. This half we are talking about. Front of chest is 9 and back of chest is also 9. Front and back of chest is 9 Then these are done. For front of abdomen and back of abdomen, you can see this front of abdomen and this is back of abdomen. Again it is 9% my dear friends. Then 9% for the back of abdomen done. Then 9. Then for both the arm, if you can see here, both the arm, what is there sir? Both the arm you will see 4.5, it will be 9, Then for the front of lower limb, one arm will be 9, this is 9, this is again 9, okay. Now coming to the next, for the back of the lower limb, it is again 9 plus 9. Front is 9, back is also 9. For genitalia, it is 1. For genitalia, it is 1, my dear friends. Genitalia, it is 1. Totally, if we'll calculate with the help of calculator, so we'll get the areas. There are 11 nines, 99%. Everything. This 99. 1% is genitalia. Total area would be what sir? Your 100% area. Total area would be what sir? Your 100% area. 100% area. Done sir? 100% area. So we are moving on to the next. Modified rule is there for the children. And this is helping us in calculating the percentage of burn. We are getting with this rule sir. Now coming modified for the children, you will see 18%. 18% is there on the head, and 18% front, 18% back. Right limb 9%, left limb 9%. Now the lower limbs are bit tricky right here. 13.5. Front and back both. 13.5, my dear friends. And there you will see 13.5. And genitalia is again 1%. So total it would be the 100%. Total body surface area would be the 100%. Now there is a calculation by the Parkland's formula. Parkland says 4 into total body surface area into weight. And x by 2 is given in first hour, x by 2 is given in another 16 hours. But these days latest guidelines are there. Latest we follow ATLS protocol. What ATLS say? If it is adult, then the rule is different. What rule is there for the adult? Adult is 2 into total body surface area multiplied by body weight. If it is child, we calculate with the help of 3 into total body surface area into body weight. If electrical death due to electrical injury, if electrical injury is there, electrical burn, or you can say, then the rule will be 4 into total body surface area into body weight. Now after this you are getting the x value. Now the rule says x by 2 is given in first 8 hours. Another x by 2 is given in remaining 16 hours. In 24 hours fluid. This is how we have to give the fluids in case of a burn patient, and this is how to calculate the body surface area. Now we'll see something else right here, sir. Causes of death. Immediate cause in a burn. For example, if someone is there in the room and there is a fire, immediately the person will die because of the suffocation, and there will be soot particles which are settled onto the esophagus. My dear friends. So first day, if the person is, immediate cause is suffocation, but if on the burn day the person is dying because of hypovolemic shock. That is why fluid replacement is very important role playing factor here. Second day, the person can die because of acute renal failure. There can be AKI, acute kidney injury, which will lead to creatinine ratio, etc. Everything will be increased and the person will die. 3 to 4 days person was saved, but person died of septicemia. The most common organism which is causing death would be, what sir, your Pseudomonas. Pseudomonas would be, what sir, your Pseudomonas. Septicemia, and most common organism is, what sir, your Pseudomonas. So what we are gathering right here, sir, immediate cause of death will be suffocation and soot particles are there in the tract. And this is for the antemortem. Antemortem death. If postmortem, then soot particles will not be there because person was not taking breath. Someone killed the person and then sent that person into the fire, then thrown that person into the fire. That is why immediate cause is suffocation, and in that if died of suffocation, you will see the soot particles right there. Now, first day hypovolemic shock, second day acute renal failure, 3 to 4 days there will be, what sir, septicemia. Now postmortem finding in the burn patient. Let's talk about this postmortem finding in the burn patient. First, there will be smell of petrol or kerosene if someone died because of that. Plus there will be burn body, plus on face you will see crow feet sign like this. If this is a face, you will see like this, crow feet sign. Froth from mouth and nose as smoke irritates the pulmonary lining. The smoke is irritating the pulmonary lining, my dear friends. That is why there will be, what sir, there will be froth coming outside. Now blisters will also be there. So let's differentiate between the antemortem and the postmortem blisters. So blisters are also there. So we are having antemortem blisters and the postmortem blisters, my dear friends. If we talk about the antemortem blisters, in the antemortem blisters the fluid is present, but in the postmortem blisters, that means person died already. Person was dead before fire, then only gas is present. And antemortem blisters, the edges are red. Edges are red, my dear friends. Then in the postmortem blisters, red color is absent. You will not find red color at all. In the antemortem blisters, edges are red. In the postmortem blisters, the red color is absent. These are the basic difference between the antemortem blisters and the postmortem blisters, my dear friends. Now internal finding of antemortem burn. So in the antemortem burn, you will see there will be a antemortem, that means person was alive. Person was alive before death, before burn, before fire, burn, anything. Now see for carbon deposition in the airway. Yes, carbon soot particles will be there in the airway. Person was breathing, because of that breathing in the air with the respiration, it went inside. Then carbon monoxide will increase. In the body you will find carbon monoxide. Also carboxyhemoglobin. Carboxyhemoglobin will also increase in the body, my dear friends. Plus serum cyanides level will increase. Plus there will be a curling ulcers, my dear friends. If there is a head injury, then you will see Cushing ulcer. But here in case of burn, you will see the curling ulcer, my dear friends. You will see what? Curling ulcer. Now what are the non-specific finding we are having? Heat stiffness or pugilistic attitude. What is pugilistic attitude? What is heat stiffness? What is happening? There is a protein in the muscles, and due to increase in temperature, the protein start coagulating and they become stiff. That is what this kind of attitude is there. that is pugilistic attitude or boxer's attitude like this. Boxer's attitude like this. Then heat rupture will be there. How there is a heat rupture? Coagulation and then drying of the skin. As I told you, the protein will coagulate. Once the protein is coagulated, the skin will become very much dry and it is very easy to tear that skin. Very easy to tear that skin, my dear friends. Then coming to next thing, splitting of skin which looks like incised wood. Splitting of skin will be like that. It looks like an incised wound if there is a heat rupture. Heat hematoma due to intense heat hematoma in the extradural space. EDH, extradural space. EDH, extradural hematoma will be there. And yesterday only we have learned about the M'Naughton's rule. M'Naughton's rule, my dear friends. In M'Naughton's rules, there is a lucid interval. Lucid where insane, sane, insane, or you can say sane, insane, then sane. Who is not responsible for any crime? Insane is not responsible, sane is, yes, responsible. Then fourth term is heat fracture, my dear friends. Fourth term is what, sir? Heat fracture. There is a drying of the bone which will lead to the heat fracture, which will lead towards a heat fracture. Now, let's write down something which is burn versus scald. How the scalds are happening? Scalds are happening because of the moist heat like steam. So let's draw this table, my dear friends. What are the table? First we'll write the cause, then blister. Then we'll write something called as what, sir? Your charring. Here we'll write burn. Here we'll write the scalds. So we'll just try to see. Cause in the burn would be dry heat. In the scald it will be moist heat. If we talk about the blisters, yes, in the scald blisters are present. In the burns blisters are absent. Or you can say only found in second degree burns. Absent normally. Second degree burns you can find, yes. Charring is present in the burns, that is blackening, tattooing. But in the scald, charring is absent. So this is a basic difference between the burns and the scald. My dear friends. The next topic is hypothermia. Injuries can also happen because of decrease in temperature. So, what is the core body temperature? The core body temperature, less than 35 degrees Celsius. If the core body temperature is less than 35 degrees Celsius, then we consider a body is going on to hypothermia, my dear friends. Now, we'll again write what is the site of measuring. What is the site of measuring the temperature? Site of measuring temperature, if we talk about, sir, one is rectum, another is esophagus. In the rectum, what we have, sir? The rectum, 15 centimeter inside. In the esophagus, it is 24 centimeter inside. 24 centimeter inside, my dear friends. Now, we'll have the classification of hypothermia. How to classify the hypothermia? We'll write there, sir. Classification of hypothermia. Classification of hypothermia will be dividing into three: mild, moderate severe, mild, moderate and severe. What temperature we are having? If we talk about the severe, less than 28 degrees Celsius. In the moderate we are having 28 to 32 degrees Celsius. And in the mild we are having 32 to 35 degrees Celsius. Now you will see what are the symptoms which are produced, my dear friends. If we talk about the symptoms, if the temperature, the core body temperature is between 32 to 35, the body will be presenting with shivering. The body will be presenting with the shivering. Now moderate 28 to 32 if we talk about, sir, there will be low reflexes. Low reflexes. Plus J wave will be there. You will be seeing the J wave, my dear friends. Other than that, if there is a severe, in the severe what can happen, sir? Coma. The person can go into coma. Plus, my dear friends, there will be a paradoxical undressing. We'll see what this is. Paradoxical undressing, what is happening? The person is suddenly feeling too hot and person remove the clothes, but because of the cold the person will die. In short, it is that. Now hide and die syndrome plus severe hypothermia, you will see hide and die. The person is hiding to just keep the body warm, but person died while hiding. It looks like homicide, but it is not. You can easily rule it out, my dear friends. Other thing we need to discuss right now is the paradoxical undressing. The next topic what we are going to learn right now is paradoxical. We can write there, sir. Next heading, paradoxical undressing. In the paradoxical undressing, you can write like this. There is a severe hypothermia. Severe hypothermia. Because of the severe hypothermia, there is a failure of vasoconstriction. There is a failure of vasoconstriction. Failure of vasoconstriction. What will happen? Sudden cutaneous vasodilation. Sudden cutaneous vasodilation. There is a sudden cutaneous vasodilation. Severe hypothermia, because of severe hypothermia, there is vasoconstriction which fails, and there is a sudden cutaneous, small vessels will get dilated, and because of that small vessel dilatation, the person feel warm and removes the clothes, and then after removing of the clothes there will be death, and this death is happening because of the hypothermia. This death is happening because of the hypothermia. So again I want to tell you, paradoxical undressing, severe hypothermia, then failure of vasoconstriction, then sudden cutaneous vasodilation is there, then person feels warm, person removes the clothes. Moment person remove the clothes, the person dies because of the hypothermia. The person dies because of the hypothermia. Now hide and die syndrome. The next topic what we are going to start is hide and die syndrome. Hide and die syndrome, my dear friends, what is happening right here? Severe hypothermia is there. Severe hypothermia. Because of severe hypothermia, the person try to hide to keep body warm, but the person die. Now this death under table can happen under bed, in Almira, anywhere it can happen. So because of these circumstances, it mimics homicide. It mimics homicide. So we have to take care of all those things. Homicide. Answer. Now, how to manage the case of severe hypothermia? Management. We write here, sir. Management of severe hypothermia. Management of severe hypothermia. How to first we'll do the rewarming. Rewarming is done with the help of water, clothes, etc. 37 degrees Celsius to 40 degrees Celsius. We maintain the temperature. Then cardiopulmonary bypass. Cardiopulmonary bypass can also, we can put on the patient on this. Okay. Now we coming to the autopsy finding, my dear friends. Another thing is autopsy. Autopsy finding. In the autopsy finding, you will see the pink hypostasis. You will see the pink hypostasis, or you can say lividity. Pink lividity, we have learned pink lividity. Why there is a pink lividity? Due to increase in oxygen in blood. Next thing is, you will see fat necrosis in the pancreas. Another thing what you can see, sir, very important name, Weschnitzky's bleeding in GIT. Weschnitzky's bleeding in GIT plus white hypostasis. Also you can see. These are the autopsy finding you are going to see, my dear friends. The next topic is frostbite. What is frostbite? Freezing of the tissue. Is called as frostbite. So what are the stages we are having in the frostbite? Stages we are having the frostbite. Stage 1, stage 2, stage 3. 1, 2 and 3. If we see right here, sir. Stage 1, stage 2, stage 3. Stage 1, if we talk about paler skin is paler, and this is reversible. Now stage 2, superficial bite is there. That means loss of sensation. You will see loss of sensation. 3 is deeper bite. In deeper bite, you will see edema. You will see blisters, painless blister. Plus you will see gangrene. Gangrene. Next thing we need to learn here only, sir, that is trench foot. Why you will see the trench foot? Once due to prolonged immersion of foot in water. Now question comes, this is seen in antemortem, drowning, or postmortem drowning. So your answer would be both. This is seen in both, my dear friends. Thank you so much, my dear friends.